Hi. Welcome, everybody, to Knock Knock Hi with the Glockenfleckens. I am Dr. Glockenflecken, also known as Will Flannery.
I'm Lady Glockenflecken, also known as Kristin Flannery.
Kristin, how did you sleep last night?
You know, it was, I slept well, but not long enough.
You track your sleep.
Well, I have an Apple Watch, so.
But do you wear it? Don't you have to charge it while you're sleeping?
No, I usually charge it like while I'm getting ready for bed and stuff. And then by the time I actually go to bed.
Because you want to wear it while you're sleeping.
Yeah, well, here's the thing. The reason I wear mine, and it's like a bonus that you get to see how you slept, but the reason I wear mine is because the alarm will vibrate. So sometimes I will sleep through my, audio alarm, but then the vibration always gets me. Mm-hmm.
Seriously?
Yeah.
Huh.
It's true.
The loud ass alarm that you have doesn't get you, but a little tiny watch vibrating does.
It's so ironic because like any noise during the night, the slightest sound, I'll be up immediately. But then come morning, I'm just dead to the world.
Something about morning time.
Yeah.
Your body hates it. Well, the reason we're talking about sleep is because we will be joined on the podcast here in just a few moments by Sleep Dr. Chris.
That's right.
He's great. So if you have Instagram, that's where I've seen him, but he's on YouTube, all Facebook, the social media.
TikTok.
Sleep Dr. Chris, board certified sleep medicine doctor and board certified pediatric neurologist. You know how hard it is to get one board, much less two boards?
I know.
Double boarded.
And one of them in neurology, no less.
Absolutely. So hard. Sleep expert, just knows so much, and we just
could have talked to him for hours and hours and hours. I seriously have like 100 more questions.
Yeah, we have to have him back because he's very knowledgeable, fun to talk to, and we just peppered him with questions.
Yeah.
And so if you're
may or may not have been a sleep therapy session for us.
Right. So if you yourself have sleep issues, you want to, or you have sleep apnea, or your kids have sleep issues, like this is the podcast to listen to. So we're excited to have him on, and he also has a book. I'll just say that at the beginning.
Yes, a children's book.
Yep, it's called
Sweet Dreams.
Sweet Dreams, and he talks a little bit about that. So check that out. Sleep Dr. Chris. Should we get to it?
Let's go.
Here we go. Hey, Kristin, remember how you love eyelid mites now?
Mm-hmm. Sure.
Well, there's a lot of confusion out there. I want to clear something up.
Okay.
All right. People think they can get eyelid mites from dogs and cats.
Can they?
No. These particular Demodex mites are specific to humans.
Okay.
So spread from dogs and cats is not expected. That's a myth.
Can't get them from cuddling our poodle.
No. Demodex mites that cause blepharitis live on humans. Most adults already have them. They just usually don't cause problems. It's when they overgrow that they can lead to itchy, red, irritated eyelids. Those little collarettes.
Mm-hmm, the crusties at the base of the eyelashes.
Right.
And the good news is there's a prescription eye drop available for Demodex blepharitis.
That is great news. To learn more about eyelid health and Demodex blepharitis, visit miteslovelids.com. Again, that's miteslovelids.com to learn more. This ad is brought to you by Tarsus Pharmaceuticals. All right, we're here with Sleep Dr. Chris. Chris, thank you so much for joining us.
Thank you, guys. It is a pleasure being here. I love what you guys are doing. And look, I'm just a guy that likes to talk about sleep, so I'm glad I'm on the show.
Well, good, because we have a lot of questions about sleep. I feel like sleep just dominates our lives.
Yeah, especially now when we're in our 40s.
Questions surrounding it with
We've got kids.
Yeah.
Like everything is sleep.
So many sleep things. So we're just going to jump into this. And first of all, before we started recording, you let us know you're having some internet issues at your work. So you're recording this in your bedroom.
I know. Isn't it appropriate? And yeah, I had some internet.
You're not supposed to work in your bedroom. I know that about sleep hygiene. So you're gonna have to explain yourself here and tell us about this.
So that's why I always tell patients this. The bed is only for three things.
Okay, all right.
And they all start with the letter S. So if you're sick, if you're sleeping, you know what that third S is for. It's not happening. You're not in bed. So I'm in a chair. I'm not in my bed.
Okay.
All right.
Even though it would be good. So I thought about that, but I'm like...
Let the record show our guest is not laying in bed. It's happening in a chair. All right. Good. So here's really where I want to start. You're kidding yourselves with these sleep studies, right? Like, look, listen. Okay. I did when I had my cardiac arrest,
Yes.
6 years ago now.
Uh-huh.
One thing, obviously, they were just checking everything, right?
Yeah.
And one of those things, I was referred for a sleep study. Uh, Honestly, don't know how. Maybe you can, help.
Something about sleep apnea
Right.
being
Maybe that
involved
could have
can.
caused my heart something.
Spoiler alert,
Anyway,
nope.
but I'd never done like any kind of sleep study before. The wires, my God, the wires.
Yes.
So
Yeah, how are you supposed to sleep so that your sleep can be studied?
good place to start.
All right, that is a really good question. And the funny thing is, I told my patients this about like a sleep study, especially in the sleep lab. It's like a bad night at the hotel. Like
Yeah.
you're going to have wires connected to you. You're going to be in a foreign place, and you're literally going to have a camera looking at your every move. Yes, there's some
I hope
voyeurism
that's not
parts of it.
happening at the hotel, that third one, but you never know.
I know. Well, I know. And so with the sleep study, you know, we actually you get about a good 8 hours of data. And out of that 8 hours of data, honestly, I only need a good 20% of it just to get a sense of what's happening. And so that's really good about an in-lab sleep study or a polysomnogram. And so even though like people don't sleep well, and I get that all the time, it's like, I'm not gonna sleep. I assure you I'm not gonna sleep. And then they sleep. Or
Mhm.
and then sometimes they don't, but they give me enough. Like if I get a little over 2 hours, I can get a sense of what's happening. And those
Yeah.
wires, we're looking at a lot of things. We do look at the heart rate when it's happening. We have a flow sensor that looks at the flow of when you're breathing in and out. So if you are snoring or have pausing breathing, I'll see the flow either blunted or absent. And it also
Oh,
will check from your mouth. So there's like a thermistor you breathe in and out. So you have these two flows that are going. A belt around your chest,
okay. Yeah.
because if you have pausing and breathing, your body's like fighting to breathe. And so I can see that. And also on your abdomen as well. And just, for fun's sake, not just for fun, but we also have it on your legs because if your legs are moving, those are other disorders that we can look at within your
Mhm.
sleep study. So sleep
Restless leg
apnea.
syndrome.
Mhm.
Exactly. Well, it's periodic limb movements of sleep, which is a cousin of restless leg syndrome. So you don't
Mm.
necessarily need a sleep study to get restless leg syndrome. And a lot of my
Mhm.
colleagues always do that because 80% of people that have restless leg syndrome will have periodic limb movements of sleep. And so if we see that at night, then if I haven't asked them already, I'll ask them about symptoms of restless leg syndrome. So those are the benefits of looking at a sleep study or for an in-lab polysomnogram. Now, if you specifically want just sleep apnea, there is a home sleep apnea test. So there's one you can do at
Mm.
home. Less wires, we still get the information. The hard part about it is really good at saying that you have obstructive sleep apnea. So the positive predictive value is like 97%. But if it's negative, that means it's inconclusive, and
Mhm.
then that means it's only like the negative predictability
Yeah.
is kinda like 70%. So we take you into the sleep lab. So if I'm just looking at them thinking if they have obstructive sleep apnea, then I probably would do a home sleep apnea test if they meet the criteria.
Mhm.
Now, so let's talk about sleep apnea because obviously this is probably a big part of your job. And uh what's in particular, I feel like I've seen some misinformation surrounding sleep apnea. Is there are there any what are the big misconceptions that I think people have around sleep apnea that you can help kind of set the record straight on?
Oh, most definitely. And when it starts with sleep apnea, it starts with snoring. I always tell everybody snoring is not normal. And before I talk about the misconception, I know that we know roughly what obstructive sleep apnea is, but you get to come into Dr. Allen's office. And so you get to be part of one of Sleep Dr. Chris's videos where I talk about it. And so you fall asleep, all the muscles in your body relax, your legs, arms, muscles in the back of your throat. So if that's your mouth, it's the back of your throat. When you're awake, airway's open, air is going in and out, no problem. But then you fall asleep, muscles relax, and right in the back it gets small. So when you're sleeping and breathing in, the sound people hear is That's how snoring happens. Now, with obstructive sleep apnea, your muscles relax more, then all of a sudden, the airway is closed. So, or either very diminished or closed. And so no oxygen is going to your heart, your lung, or your brain. But they don't know what's happening back there. So heart's working harder, lungs are breathing in deeper, brain sending stress signals all over your body. So all of a sudden, you wake up. Well, not you, your body.
Okay.
Sometimes you. Then you can fall back asleep and it happens over and over and over again. That's obstructive sleep apnea. Now, one of the misconceptions is that, like, well, it definitely happens in men more until after menopause, and it's like 1 to 1. And then
really?
also, like, and then also for people is like, well, it's only for people that are overweight, but it's also anyone can have any size because it's about airway. And so I see people of many shapes and size, men and women, that can have it. And that's the hard part about obstructive sleep apnea, because in the sleep world, we're really good about talking about Cpap therapy, and that is continuous positive airway pressure. And that last word is the most important part, pressure. You wear a mask and your pressure's open, keeping the airway open, so no more snoring and no more pausing and breathing. But there's more than one way to treat obstructive sleep apnea. I'll be in my office and I'll see a patient. I'm like, hello, my name is Doctor. I'm not wearing that seed crap. And I'm like, I was like, hold on. I was like, hold on. I was like, okay, they've been through this before, or they've seen like they'll have heard their friends that have had problems with it. CPAP is great. I sound like a cheesy commercial, but not only my doctor. I have obstructive sleep apnea. I've been treated for 22 years now. And so I use CPAP therapy, but there's more than one way to treat obstructive sleep apnea. So those misconceptions that, anyone could get obstructive sleep apnea, young and old, it's different in kids than it is in adults. You don't need to just necessarily use CPAP therapy. And the thing is that snoring is not normal. Does it mean that you have a sleep disorder like obstructive sleep apnea? Definitely not. But it does mean that you have to start asking those questions.
So as Kristin gets older, she might start snoring just as much as I do. Is that?
Well, that's uncalled for.
I'm just saying, it might not just be me.
Right now, it's you.
You know, the funny part about it, when I see patients, when I talk about their bed partner, either if they're there or not, they're going to attack them. It's like, well, because the two famous words that I hear from the majority of my patients, especially male patients, are my wife or my spouse. I was like, well, my wife says I snore. My wife recorded me. My wife said I needed to come here. And the thing is, when I ask them,
a lot of recordings. I bet you hear a lot of recordings.
Recordings, pictures,
they're getting
letters.
Receipts.
Yes, they are.
Do we know the physiology between like it happening more in men? Is that all? Is just anatomy? Like we just maybe have like thicker,
larger,
more like neck tissue, basically.
So definitely, anatomy does play a role with it, and because when you start getting into perimenopause and then menopause, like muscles are relaxing, and things droop, and not just outside, but also inside as well. And there's propensity for sleep apnea to happen, especially in women too. But honestly, it's still happening in young women as well too. And so that's the cool part about it, because it's anatomy. So if you have a family history of someone that snores or is on CPAP therapy, you have to look at yourself. And it's hard. Like I was saying, like as soon as I talked to them, I was like, well, your spouse says that you snore. It's like, well, they snore too. And I'm like, well, tell them you know a guy. And but it's funny because once you get treated, it's just a world of difference. But sleep is personal, sleep is intimate, and sleep is sacred. And sometimes it's hard to describe because people try to give excuses like, well, I snore because I sleep a lot, or it's only when I drink hard. And I was like, and I understand that, but knowledge is power. So I was like, well, let's see what the test shows, and then we can move forward and see what happens.
Yeah, why are people so defensive, immediately defensive if someone accuses them of snoring? What do you think, like, from what you've heard from people?
I think it's the stigma because one, everybody wants to sleep and everybody wants to sleep well. But when you have a disorder like obstructive sleep apnea, you, like I was saying earlier, you think of CPAP and like, oh no, I'm gonna have to wear the Darth Vader mask.
Yeah.
But there's more than one way. And even if you wear that, it's just the quality of life gets a lot better. And, and a lot of people, it's like a reminder of like, okay, well, I'm getting older and now I have to go to bed with something on. And I get that all the time. I get the stubborn men that wants to say like, there's no way I'm going to wear it. I was like, I feel like it's like green eggs and ham. That story, it's like Sam I Am and he's talking to the guy and he's like, try it, then you'll see.
Yeah, right.
And so we try it.
Give it a shot.
I know. And then they notice a difference. They're up, they'll wear it in a box. They'll wear it here or there, You can tell I'm a parent.
I'm impressed by how quiet they've become.
Like, oh yeah.
It's wild because my dad wears one and I've seen it and seen him wearing it and it is so almost silent. I was shocked. It's like I was like at least if I in my mind I was like if I end up wearing a CPAP at least it's going to provide the white noise that Kristin needs to sleep.
I was literally just thinking that. I was like, if you'll get one of those, I can probably turn off that
it's not even
machine by the bed.
It's not even enough. It's so quiet. So it seems like, Chris, like the technology is just like improving with the delivery of the positive pressure.
Oh yeah, it is great. And the thing is that there's still quite white noise like aspect of it because like I don't know, you could have been sharing a bed with your dad and seeing close up, you can still hear it sometimes. So Kristin, you still might get that white noise effect that you might hear, but definitely it is quiet because your airway's open and it's going in and out. And so the only thing you're going to hear is that slight exhale. But yeah, it is great and even that is going to be way less than snoring. So there's going to be way quieter from that.
Is that a nice way of saying you'll have a hurricane in your face?
Just blow.
Hurricane
force winds just going down your.
No, it's funny. This is me putting my nerd cap hat on now.
Okay.
Because
does it look like that Scrooge McDuck sleep hat?
What's funny? I know. It's funny. Side story. So doing Sleep Dr. Chris, I was like, you know what? Maybe I should have props. Sometimes I would wear like
a little pajama hat.
I would wear an eye mask and then like Sleep Dr. Chris. I was like, I should have the hat. And I was like, no, I'm not doing that. Because
too far.
I have a large head and I'm like, what if I want to record something quick? And then I'm like, got to pull out the hat and I'm in the park. It's like, why is this man talking with like, it's like with the hat
Large head club here. Large head club here. Absolutely.
But to go back to positive airway pressure. So all it is like, it's pressure. Now you'll notice it a little bit, but you're able to breathe with it. It's not uncomfortable. It is a weird feeling at first because when I started like CPAP 22 years ago, I was like, what is this? But then you're tired, you go to sleep and it works because your airway's open. And like you just feel refreshed, you feel rejuvenated. And sometimes it might take a while for you to notice that. So the pressure remains the same. So you breathe in, for example, the pressure on a typical CPAP can go anywhere from 5 to 20. So when you breathe in, they say it'll give you a pressure of 7. You breathe out, the pressure of 7 is still the same. So in and out, it's a pressure of 7 centimeters of water, where that's the scale that they put it on. And they'll keep your airway open and they'll figure out. And these machines are so smart, it can find the pressure, the perfect pressure to treat you. So it'll start at, it can start at 5, go all the way up to 20. That's an auto CPAP. But so what I usually do, I'll have my patients on auto CPAP. And then when I see them back, I'll personalize it to them because it'll find their perfect pressure.
That's so cool.
There's quick ways to make sure that you're treated.
So going back to the white noise thing, can you like, I don't know if I'm sure you do, just about like the I don't know if it's the right term is like the psychology, but the science, like why does Kristin require what sounds like...
This is one of the most contentious issues in our sleeping
Why
lives.
does she require a jet engine right next to her bed? Is it like she's trying to just block out all
I'm trying to make my thoughts go shh.
Like what do we... What is it about white noise? Because it does help me a little bit. I don't need it as I don't need it like.
I got it on recording. You said it.
I know,
it's fine. I just don't need I don't need 50 decibels. It doesn't have to be that loud. But anyway, there's got to be some science there, right?
Yeah, so a little bit about it, because when you're falling asleep, I always tell people your bedtime, it starts about an hour and 2 hours before you actually get in bed. And I want people to fall asleep. I want people to go to bed, not fall asleep. Like literally going to dreamland is like landing a plane. And so if you just go to bed and then bam, that's literally crashing. So you want to make sure you have certain criteria that helps with that. And when we live a lifestyle, and especially with women, women go to bed, they're not just thinking about, let's go to bed. They're thinking about what happened today, what's happening tomorrow. If you're a
Who
mom,
needs what sign?
and if you're a mom, then happy Mother's Day to all the mothers out there. If you're a mom, thinking about your children and what needs to happen next. And so there's all this stuff that can build up your anxiety. And so when you're going to bed, sleep hygiene is everything. I know I said the bed's only for 3 things, but also you want to make sure that your room is cool, quiet, and dark. And what that white noise does is cancels out some of the thought processes that you could be having going on.
See,
and the certain hertz can help with you going to bed and having that relaxation to go there. It's funny, my wife, she uses it as well too. And I can fall asleep to anything, so I'm like, it does get me in the middle of the night. I wake up, I'm like, what's happening? It's like, oh, that's the white noise.
Well, I've been trained now because whenever I go, when I'm in a hotel by myself,
it's too quiet.
I'm like, man, I'm so used to a jet engine in my ear that I feel like I can't, sleep as well.
Well, that's the other thing too, is it drowns out the other noises. So if you're in a hotel, it drowns out the hallway noises or whatever.
Oh, yeah.
But especially since I became a parent, I have never slept super deeply all night ever again, right? If there is a noise, I will hear it and wake up. So
yeah,
I mean, that's worked out to your benefit.
I get it. Yeah,
before.
That's true.
But if I have the white noise machine on, it'll cancel out, just the little house noises and, just the little everyday noises that can happen.
Yeah. Let's take a quick break, and I have some more questions for you.
Ooh.
All right, we are back, and okay, tell us what this is. All right, Dr. Chris.
I don't know where this is going.
I know.
So exciting.
What if your spouse, I'm not going to say who it is between the two of us, wakes up in the middle of the night, gets out of bed, puts on a pair of dress pants, inexplicably, like slacks, and then
specifically male dress pants,
and then gets back into bed to go and goes back to sleep. What is that?
Well, first of all,
that's my question.
It's interesting. It's funny. It's interesting. And I will tell you this much. I've heard a lot in my day. Literally a decade being a sleep doctor. I've heard a lot of things in movement, but going and putting on male slacks, I gotta say, that's the first time I've heard that.
Yeah.
No, I've heard
he was getting ready to go to work.
Well, guess what? You're going to get a lot of patients who are going to hear this and be like, "Oh, I'm not the only one." And now you're going to hear all of maybe everyone out there doing it. I'm just the only one that's brave enough to say something.
I don't think so.
About my pants habit in the middle of the night.
No, okay, it's not always pants, but he does do very strange things in his sleep sometimes, and he sleep talks for sure. Sometimes does things like that, kind of sleepwalks. I think when you were a kid, you slept walk.
I had night terrors as a kid.
Night terrors. He has leg issues going to sleep. Your blanket habits are unrelated, but also strange blanket. He's got to be a burrito. His sleep is an issue. He is a weird sleeper.
I've never tried to do anything dangerous. It's not like...
Well, I lock the doors so that...
I don't try to leave the house or anything. It's just I don't know. So
there is a category for everything that you're talking about. And that category is called parasomnias. It's just a fancy way of saying, in medicine, we love giving fancy words.
Yeah.
And so it's a fancy word of saying that I'm doing something in my sleep that you're not supposed to. And so that's the big umbrella of it. And then it breaks down into like two parts of it. Is it happening during your non-REM sleep or your light sleep, or sometimes your deep sleep as well, or your REM sleep or your stage R, because that's what they call REM sleep now. And so what you're expressing is a parasomnia, doing something in your sleep that's not supposed to be happening. And now getting out of bed and moving, we call that, that is sleepwalking, that. And so now if you don't remember doing it, then definitely it is sleepwalking, getting out. And that is like a non-REM parasomnia. And that can happen. Now, the thing is that if you're not harming yourself, harming others, we make
What if
sure
you're
this to be
hurting your
aware of it.
spouse's feelings?
Well,
Sometimes he will wake
technically,
up
yes.
and I will try, and I can tell he's got his eyes are like glazed over, right? They're different than when he's actually awake, but they are open, and he will be like talking to me. And I'll try to just like get him to like go back to sleep. And sometimes he's like, "Stop it. Why are you doing that?" He's like getting mad at me.
Now, it's funny. We're checking a lot here. Yeah, well, the check's gonna be like the bill's
Lay it
gonna be in
on
the
us.
mail. Jeez.
Bill us.
I was
Right?
like, I know.
I got good insurance. Let's
I know.
go.
Hold on. I know. We know it's not United. It's
Nope,
like,
definitely not.
zing.
Definitely
um, so there's many types of parasomnias, and so there's sleepwalking. And what you have where you're up, because sometimes people can get into something that's called a confusional arousal. So like you're up enough
Yeah.
to do things, and
Yeah.
if you are not up for more than 5 minutes, like you're conscious, you're not conscious. Like you're up and you're moving, you're conscious enough to do enough to respond to somebody. They'll call it sleep drunkenness sometimes because you're like, I don't remember that. Are you
You
sure
kind
I
of are
said
like
that?
a drunk in that state
Yeah.
too. Yeah.
And so the cool thing about parasomnias, it depends on what's happening with your sleep. And I heard that you said there could be a chance that there could be sleep apnea. So treating that could definitely decrease those from happening. And if it's still
Okay.
happening, the cool thing is that there are medications that actually stop it from happening. Now, if someone sleep talks, that still is under the umbrella. We call it somnambulism. So you're just sleeping and talking. But as long as you're not like moving or harming yourself and others, and Chris, you made me think about feelings. I'm gonna start asking my patients that. Like,
Right?
I know you haven't
Sometimes he's
physically
kind of
harmed her,
mean.
but how's her feelings?
Yeah.
He's trying to start arguments in your sleep.
Right. And then I'm mad and he has no memory of it. It's like when you're mad for a dream you had, it's essentially what it is.
Oh man.
It's funny.
I want to talk about your work with children.
Yeah.
Because that's I know you're board certified in pediatric neurology. Did I read that correctly? Yeah.
Yes.
So is that a part of your practice?
It is. And so I have my own practice for a little over 2 years. It's called Quality Sleep and Neurology. So I do pediatric neurology. And then when I was in my neurology training, I fell in love with sleep medicine. I was already being treated. And then I didn't know that, well, one, I didn't know there were sleep doctors at all. And I'm like, I just thought pulmonologists, lung doctors took care of it. But then I'm like, wait a second. It's like, there really is. And so I did a rotation. Shout out to University of Chicago. And I just saw the benefit of just treating like children in their sleep. And I fell in love with it. I love neurology, but then like sleep is my passion. And so I did a fellowship, shout out to University of Michigan, for my sleep fellowship. And you're trained for kids and adults. And I fell in love with treating adults as well. So I encompass that in my practice as well too. But with children, it's different. Small kids, small airways. There are still some factors that in adults that can show obstructive sleep apnea. But when you have children, the way that they show that they'll have a sleep disorder could be different than it is in adults. And the hard part about it, being a sleep doctor makes me a better neurologist and the other way around, because a lot of children are being labeled as ADHD, but they actually have an undiagnosed sleep disorder like obstructive sleep apnea. And so in children, obstructive sleep apnea can show inattention, hyperactivity, moodiness. And so with that, if I have patients coming in, because I get best of both worlds, that have a diagnosis of ADHD, I'm going to ask about their sleep. Because and I've had patients that came in that was on like so many ADHD medications, and no one ever asked them about their sleep. And as soon as I did, we were able to get their obstructive sleep apnea treated. They started noticing a difference in school, being able to start coming off of some of that ADHD medication. Now, can you still have ADHD and like obstructive sleep apnea? Definitely. But usually in kids, small kids, small airways. And so they have like their tonsils and they're so prominent. So when they fall asleep, the muscles relax. That's how you hear the snoring. And sometimes they don't even have to snore at all. And that's the way to treat it in children. One of the ways to treat it. Again, many ways to treat obstructive sleep apnea. And in children, not adults, an tonsillectomy can help. So taking out the tonsils and the adenoids.
Oh, interesting.
Yeah.
I was going to ask if snoring is as prevalent in that presentation of sleep apnea as it is in
It
adults.
can. So I will always ask if they snore because most of the time you still will get snoring, but sometimes it's so faint where if they have a blunting of their airway, still you can still have those symptoms, and that can still lead to obstructive sleep apnea. So I'll ask about snoring. I'll ask if they sleep with their neck arched. I'll ask if, like, you can usually see it in their eyes, like, if there's very baggy or, like, they call it adenoidal facies when they're like this, and you can tell, like, oh, they might have, like, obstructive sleep apnea because of the enlarged tonsils or adenoids. And so I look at that, and the hard part about it, and this is kinda like that personal story with me, is that I've had obstructive sleep apnea, but it's kinda like The Sixth Sense at the end of the movie, you start to realize and you start to think back from the beginning. You're like, "Wait a
Right.
second, I had it the whole time." And
Right.
so I think about when I was a child, I would snore. I would go on trips in high school. There's like, "Oh, no, we're not staying with Chris. He's snoring and it's loud."
Uh-huh.
Or in family trips, my mom's yelling like, "Turn over." And so, I always talk to, parents, and it's funny because I'll see the adults, and I'll talk to them, and if they have kids, and then it usually will lead their kids into coming to get them treated, and that's why I, made a children's book about finding out
Yeah.
about obstructive sleep apnea, so I made an adaptation of my personal story, and on social
Oh,
media, I
that's so
always tell
cool.
people, "Sweet dreams," so the name of my book.
Yeah.
Yes. Well, this is a shameless plug, I'm just throwing it
No,
out
no,
there.
Yeah.
we were planning on doing it anyway,
Yeah.
so
Ah,
now's a good time to do it. Yeah,
yes.
tell us about the book. Yeah.
Yeah, so it's my personal story, it's called Sweet Dreams. I always say that on social media a lot. It's a philosophy I believe in for having sweet dreams. There's an acronym that goes to it saying that, like, it's not you, it's your body, it's your biology, it's your airway, it's looking at the medical parts of it. And so that's why I called it Sweet Dreams, and so it's my story of how I found out that I had obstructive sleep apnea, and it's really cool because when I kicked off the book, you can if you type in Sweet Dreams, Sleep Dr. Chris, you'll be able to find it, or sleepdrchris.com. Again, all these shameless plugs I'm throwing out there. But I was reading in a elementary school because, locally and going to different classes, just reading the story to them, and you would just be amazed at how first of all, I just love children and how, like, they wanna ask you questions about it.
Yeah.
And I'm located in Saginaw, Michigan, small town in Michigan, and one of the kids like, "Wait a second, are you from Los Angeles?" And I'm like, "Oh." I was like, "No, guys." It's like, "I'm from here." But, they either I had them raise their hands. I'm like, "Does anyone sound like little" it's the character's Christopher. It's like, "Anyone sounds like little Christopher in here?" And so many hands went up, and then even some of the teachers is like, "There's a couple of students that we are concerned about. Thank you for bringing this up." And I'm like, "Well, I'm local, you know a guy," and
Oh, that's great.
and just yeah, that's the awesome part. That's why I made that book.
Yeah.
It's a story where, kids can look at it and parents can look at it too, to
Yeah.
look at those signs because if you have untreated, sleep apnea, it can get mimicked as ADHD. it decreases your performance, your productivity, and, those are the formative years. And so I'm really glad to have that book. And even at the back, there's a little part for parents, like, this is how long your kids sleep. This is what you should look for to do that. And so it's been a blessing. And the funny part is that you guys know this, when you put your personal story out there, it's, it carries a weight differently.
Absolutely. Yeah, it's an amazing form of advocacy, that you're doing and that you can use your story for, which is awesome. I would, Sweet Dreams is such a great name for your book. I feel like growing up, I didn't have very many of those.
No, you
'Cause
had scary
I would
dreams.
wake up screaming.
Yeah.
Oh, yeah.
And I feel so badly for my poor
Oh, that would have
parents
been
who,
so hard.
I remember, um, waking up to, being outside our house, with my parent. Like, they would walk me. I
Uh-huh.
would just, all of a sudden, I'm, on the sidewalk, in our outside our house, and because I had one of these, night terrors, so not a lot of sweet dreams happening.
No.
Is that
Yeah,
I don't know, yeah. What do
Yeah,
you
what's that about?
Yeah, yeah, that's right. That's my
no, so
question.
what is
What is it?
No, that's funny because, again, going with night terrors, which, again, things that are happening in sleep that's not supposed to, is still under that parasomnia window. And
Yeah.
the cool thing about it is that you don't know that it's happening to you, but
Mhm.
everyone else around you
Mhm.
does.
Oh, yeah.
Yeah, and it's a difference between a nightmare because, that's the monsters under my bed you remember.
Yeah.
And we know that, dreams, that's a part of REM sleep. That's the REM parasomnia as well, where, you can remember the nightmare and everything. The hard part about night terrors, you're yelling, you're screaming, you're thinking something's wrong. It's almost like crying wolf because you
Mhm.
go there and you're like, wait a second, you're okay. And you're trying to wake them up. And it's like, I have to wake them up. And the funny part is that I know that. And it's different when it happens to your own child. And
Oh,
I
yeah, for
Yeah.
remember
sure.
I have 2 kids. They're 11 and 9, and my youngest, he has night terrors. And I remember the first time it happened, there's night terrors, sleepwalking, and confusional arousals. I remember he came up and he likes Mario. He was talking to me about Bowser, and I'm like,
Listen, when he has a bed partner someday, you send him to me.
and,
For what?
yeah,
Well, he just listed off the 3 of the things that you have that his kid
Oh,
has, so I
yeah.
can help that
some
person
advice,
out.
yeah.
Yeah.
I know some advice. I know. The funny part when I first heard the yelling, you hear your child yelling, you're running, and
Yeah,
I'm
it's
like,
terrifying.
it is. And I'm like, oh, this is a night terror. And then it happened the second time, and my wife was really upset because I'm like, it's fine. It's a night terror. She's like,
Yeah.
fine. It's fine. And
Never
so
Doesn't look
fine.
fine to you?
I know
Yeah.
it's scary, but knowing that and that's the hard part. So you go in there and you just make sure that they're consoled. You don't have to wake them up. And that's the hard part because
Mm,
you think they're having a nightmare. They're not. You just let it pass,
mm.
and it's about education. It's education for the parents, education for the siblings too, because then,
Well,
my
sure.
daughter's involved. She runs down, it's like, "Y'all don't hear that?" I was like, "All right,
Yeah.
let's go back." But here's a nifty tool to do this for anyone that's listening, and because this happens a lot. One, know that it's not hurting your child. It's not hurting the person that's having the sleep terrors. And then if you know around the time it happens, a half an hour, just wake them up and
Oh,
then go right back to bed. And sometimes that'll decrease it. But then also, if it's happening, it's good to get that sleep, get a sleep provider involved because there could be a sleep disorder that can actually make it better.
yeah,
Mhm.
yeah. So these are sometimes in some families, it's happening consistently enough. It's like every night.
No,
This is
definitely. Yeah, and the thing is
wow.
that more times when I see that in my clinic, I make sure to rule out everything else that's happening because other sleep disorders, when the thing that makes night terrors worse is if you don't have great sleep. So I need to look at everything that's messing up their sleep to make it better.
Mhm.
Gotcha. How long are these appointments? Because man, you're because there's so much to it, and
Yeah.
It is.
I mean, it doesn't surprise me. It's, this is
I would imagine
pretty
this is not
complicated
a
stuff.
one and a done appointment situation. It seems like maybe a series.
It can be. And, it's funny. Anyone that sees me, I always joke with them. I'm not a sleep apnea doctor. I'm a sleep doctor. So I have to look at the whole array of sleep in a shorter period of time. And, we can have another podcast about like timing of how much time you can spend with your patients. But at least for me in my practice, I at least try to at least give you 40 minutes. And if it feels like it needs to go higher, then there's things we can do to move things around. But there's the benefit of a sleep questionnaire. Everyone complains about it, but it's like, well, at least I can start somewhere to know what I need to look at to help with the time. But as you know, sometimes people don't fill out the questionnaire. And so you have to go over those boxes just to make sure of what to look for. And so I make sure that you have a comprehensive sleep exam and a sleep history because a lot of people miss things. People is like, oh yeah, I have sleep apnea. It's like, well, don't you know you have periodic limb movements of sleep now? According to this question that your wife filled out, you start punching in your sleep. And that's not normal.
Been there.
Yeah.
Not long ago, actually. A couple weeks.
And so, we have to look at those things.
Oh, sure. Well, there's a lot that goes into sleep hygiene, and I have been really enjoying seeing your presence on Instagram. And
I did feel a little attacked, I have to say.
That was my point. We're getting that.
That's where we're going? Okay.
Oh yeah, because you've got a couple of your pinned posts on Instagram. They're crazy viral, these things, and I think it shows how much this is on people's minds, right? Everybody wants to have good sleep, and so hearing some real tips from a sleep expert specialist it means a lot, and I was just looking at some, and I feel personally attacked by a lot of these things, which is the point.
It is the point, and it starts the question. And I had this viral series that I call them hard truths, and I broke it out like hard truths for parents, hard truths for night shift workers, and there's hard truths about your sleep because you do feel attacked, but it makes you look at it, and it does. And I remember, I'm very fortunate to be on social media and be in a space where I can be on a platform to talk about things because there's a lot of things where it's not true or a lot of people, get, bashed for it. And my thing is if I call it out in those hard truths, I call it out in love to say this is what can happen and it's a hard truth, but it sets you free. And that's the biggest, part about it. And I'm very fortunate because I've had later after I started some of those series where people come to me, it's like, Sleep Dr. Chris, because of you, my husband got a sleep study now. Now he's using like a Cpap and he's sleeping a lot better. Thank you. Or you made me go back to the sleep doctor. Or you know what? You made make me have my child to go in and get like a sleep study just to see if something's going on. So yes, those are hard truths, but I feel like those are the things that make it better, and it starts the conversation. And how social media is. You have to shock and awe a little bit.
Yeah,
to
you gotta
keep
get that
them.
hook. Yeah,
I know the hook.
Oh yeah. And I was gonna say one of them. I'm actually looking at these tips right now, and one of them specifically, you talked about this people like postponing going to sleep. Like you're like basically. I can't find the exact one.
like
that
as
I
a
saw.
treatment, like make yourself really tired.
No, well, it's like you're just putting it off. Like you don't want to go to sleep, or your brain is not wanting to go to sleep, and so you scroll and you or watch TV and just like I don't want to. You're like not letting yourself do it.
Yeah. It's funny because I spend all day wanting nothing more than to go to sleep. And then nighttime comes and I'm like, well, time to do my laundry.
Why do I guess so Chris, why do our brains hate us so much?
It's not that it hates you. It's that we're in a stress loop. That's what usually happens because you go through the day and we live in a society that is advanced. We have devices that we can look at our phone and make sure to find out like emails and keep businesses going, or also look at videos. And the thing is that your brain, when you're going to bed, it needs to get that sense that it's time to go to bed. And I know I said it earlier, it's literally you're landing a plane into dreamland.
Mhm.
And so it's a little bit of that. And then also, there's sleep anxiety. People do have that. Or if they're anxious during the daytime, and sometimes there's revenge procrastination is real because you
Mhm.
have families that parents that was like, look, now this is my time. I know it's
Mhm.
10:30. I know I'm supposed to go to bed, but I'm gonna watch this Netflix show and I'm gonna look at Instagram right now. And
Yep.
but when you do that, that's kinda like taking an espresso,
Uh-huh.
right before bed, and you're not giving your body those cues to go to bed. I literally have, shameless plug, but there's a reason why I do that because everyone always asks me, "It's like, all right, these are good. Well, what did I do?" And so,
Yeah, yeah.
I've made like sleep resets to actually hone in, not just in your sleep hygiene, but like giving you good guides and tools to figure out. It's like, okay, this is what I need to do and not in bed, and then also these are the warning signs I need to look for to say if I need to go to a sleep doctor like me, from it
Mm.
because like you fall asleep, there's all these like functions that are happening in your body. You have your melatonin, that's your body clock telling you when it's time to go to bed. And so that is very sensitive to light. So
Mhm.
some of these devices can alter that. Not fully, but it can still alter that. And so making sure when you wake up, open up your window, get that sunlight. That's getting your body that time to say, hey, it's time to go up. And when your body's melatonin, it goes like a little roller coaster. Like when it goes up, that means it's giving you that signal to go to bed. And then when you're sleeping,
Mhm.
it goes back down. And so you can start that nice circadian rhythm. And there's another process of going to sleep. So that's just your process C. And then there's a process S. So the longer you stay up, you have the sleep hunger and sleep drive. And so nerdcap hat moment, it's like there when it's building up adenosine in your body, and when it's high,
Mm.
you get tired and tired and tired. It's funny because coffee or caffeine, it blocks adenosine, so that's why you
Yeah.
get that little
Wow,
moment
yeah.
where you can stay up, but it's funny, it only blocks it behind that receptor, that door, because as soon as it wears off, boom, you crash, you go to bed. But when you have, like, anxiety and, like, cortisol levels, that's, like, helping with your fight or flight, that keeps you alert. And so when you have that stress, that also plays a role too as well. But you also want to make sure to look at your if there's any other sleep disorders. So your brain really it doesn't help. It doesn't
Yeah.
hate you. It just want to make
Well,
sure that like you have to talk to your brain sometimes. And some of these gadgets and even we're both content creators. That's why I tell people you're scrolling in the middle of the night. I know I'm going to catch them scrolling. And then it's funny, but then even though you hear all of these or these hard truths, I always tell people, give yourself grace.
yeah.
Because if you know where to go towards, then that's gonna help you along the way, and you'll be better tomorrow than you were the day before.
Well, I will say 7 a.m. me gets really pissed off at 11 p.m.
Yep.
me. And like, what are you doing?
Yeah.
Like, why are you doing
We
this to
can't do
yourself?
this
But
anymore.
but now we know it's and we could always just try to be a little bit better,
Yeah,
every
and
day,
the thing
every
is
night.
that is giving yourself grace, and there's nothing wrong with planned indulgence.
Mm.
So, for
Mhm.
example, what you can do, especially if you feel like, and Kristen, I know you talked about your mind, might have it going and racing and thinking about
Mhm.
everything you need to do. That
I
doesn't
ha I
help
have
fall
the
asleep.
delightful combo of ADHD and anxiety, so it just never stops.
I know, and it's funny with, neurodivergence, you have to be very practical. You also have to, be intentional on going to bed. I have, like, neurodivergent guides as well to help people fall asleep because, sometimes you can't follow those neurotypical advice.
Yeah.
And you have to like, it might take you 2 hours to get yourself together where you might need to look at something. Someone might need the TV on because that's their guide to like going to bed, even though I will tell people
Mhm.
don't do that. So there's ways to do that. And,
Yeah.
and so you want to make sure that you're following getting yourself to go to bed. And so you have those thoughts going, get a piece of paper and just write down what you're thinking. Like you can journal and that's helpful, but just write down words. Tired, children, husband, whatever it is, fold it up, put it under your pillow. That's telling your mind, like, we're thinking about this and we'll save it for another day. And it's a funny story because I tell my patients that all the time. And one time, sleep Dr. Chris wakes up in the middle of the night and I'm thinking about all these things. I'm like, what is going on? What should I do? And then like I hear the bubble, me talking to my patients, like, get a piece of paper. So I didn't have paper, but I had my electronic, like electronic paper. Yeah. And so I used it and I just started writing it down. And then 15 minutes, like, well, what do you know? Like, I was like, all right, I'm ready to go back to bed. So it does happen. And if it takes you more than 20 minutes to fall asleep, just get out of bed. Like, trying to force yourself to go to sleep is trying to, like, make a toddler,
brutal.
Like, eat vegetables if he doesn't want to. Because as soon as you try to push, and they're going to, like, and cover their mouth.
Yep.
Well, this has been awesome. Thank you so much. And thanks for answering all our bizarre questions.
I have a million more, so maybe you'll have to come back
we'll
sometime.
have to have you come back,
hey,
for sure.
Look, 4 words, you know a guy. And,
That's right.
Every Friday I do Q&As. And so if you want to put some questions out there, I can answer it.
I'm going to have to start using a different pseudonym so you won't know it's me. Because there'll be too many.
That leads us to letting people know where to find you.
That's right.
Yes. And so again, Sleep Dr. Chris, so Sleep Dr. Chris. You put that in search, you will find that. I make it easier because you can go to sleepdrchris.com. If you're on Instagram, Facebook, TikTok, just put in Sleep Dr. Chris. And it also, that's where you can find my book. If you put in Sweet Dreams, Sleep Dr. Chris, you can find that as well too.
Sweet Dreams. Check it out. We're definitely going to.
Yeah.
Check that out.
We've got some kids with, we're real.
Oh, yeah. Yeah.
We are real messed up over here when it comes to sleep. So
you know what?
We'll keep you in business.
Look, you are seen.
Thank you.
Okay.
Well, thanks again for coming, Chris. Pleasure.
Thanks.
Do you feel like taking a nap?
I really do.
You're not a napper.
I know, but I'm just tired all the time in the daytime.
Next time he comes on, we're gonna go deep dive on napping.
Can we do a live podcast nap?
That would be very not podcast friendly. We have to listen to each other snore.
Oh, I don't snore.
But I could probably time a nap like that.
Yeah.
I could probably do it. You couldn't do that.
You can nap on command better than I can.
That's not healthy. It's not good.
Yeah.
Let us know what you guys thought of the episode. I thought he was great. It's fantastic. Go check him out on Instagram, anywhere else, Sleep Dr. Chris, and his book, Sweet Dreams. And let us know what you think. You can email us, knockknockhi@human-content.com. Visit us on our social media platforms. Hang out with us and our Human Content Podcast family at Human Content Pods. Thanks to all the listeners leaving feedback and reviews. If you subscribe and comment on your favorite podcasting app or over on YouTube at Glockenfleckens, go check it out. We can give you a shout out. Like at Tank Guy the 3 on YouTube said, that thumbnail must be Dr. Glockem flexing. So we had a great thumbnail. We have a great Photoshop of me on like Conan the Barbarian, my face on his body.
It's Jonathan too, which makes
it
even better.
Face on Conan the Barbarian's body. I assume that's him in a hospital.
Yep.
It looks fantastic. Why does the U.S. have a barbaric ER problem? So, interesting issues going on in emergency medicine these days. Yeah. Go check that episode out to learn more. Full video episodes are up every week on that YouTube channel at Glockenfleckens again. We also have a Patreon, new and improved.
That's right.
Exciting Patreon. In fact, later today, we're recording a little something special for Patreon.
That's right.
I'm going to be answering some questions as Ortho Bro.
Yeah.
So I'm excited about that. Hang out with other members of the Knock Knock Hi community. Early after episode access, Q&A, live streams, all kinds of stuff coming. Patreon.com/Glockenflecken or go to Glockenflecken.com. Speaking of Patreon community perks, new member shout out to Charlie. Thanks for joining, Charlie. And shout out to the Jonathans, as usual. Lucia C., Edward K., Marion W., Mr. Granddaddy, Caitlin C., Brown L., MP Cole, Tracy B., Mary H., Keith G., Parker, Muhammad L., David H., Kaylee A., Gabe, Gary M., Eric B., Marlene S., Scott M., Kelsey M., Dr. Hoover, Sean M., Ryan N., Jess K., Hawkeye M.D., Bubba Salt, Shawnee D. Patreon roulette time. Random shout out to someone in the emergency medicine tier. Shout out to Jamie R. for being a patron. Thank you, Jamie. And thank you all for listening. We're your hosts, Will and Kristin Flannery, the Glaucon Pluckins. Executive producers are Will Flannery, Kristin Flannery, Aaron Cordy, Rob Goldman, and Shanti Burke. Our editor and engineer is Asa Portiza. Our music is by Omer Benzvi. To learn about Knock Knock Hi's program disclaimer, ethics policy, submission, verification, and licensing terms, and HIPAA release terms, go to glauconpluckin.com or reach out to us, knockknockhi at human-content.com with questions, concerns, or fun medical puns. Knock Knock Hi is a human content production.
Knock, knock, goodbye.
Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen, or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Help you subscribe, leave a comment below. Let us know what you think.